Welcome to dental surgery, enjoy with learning. Exodontia. It is that part of oral surgical practice dealing with the extraction of teeth and is a surgical procedure involving soft and hard tissues of the oral cavity. Techniques of extraction. 1. Intra-alveolar or forceps or conventional or routine. 2. Transalveolar extraction or complex. Indications for tooth removal. Teeth that are hopelessly carious. Teeth with non-vital pulp or pulpitis when root canal TTT is not indicated or failed. Severe periodontal disease when excessive bone support is destroyed. Orthodontic reasons. Malposed teeth not amenable to orthodontic treatment. Cracked teeth. Teeth that are traumatizing soft tissue if other treatment will not prevent this trauma. For prosthetic extractions, if teeth mechanically interfering with the placement of restorative appliance. Impacted teeth. Retained primary teeth when a permanent tooth is present and in normal position to erupt. Supernumerary teeth. Remaining roots. Teeth associated with pathologic lesions. Teeth involved in jaw fractures. Pre-radiation therapy. Economics. Inability of PT to pay or to take time from work may require the tooth to be extracted. Contraindications for tooth removal. Relative in their strength. In some situation the contraindication can be modified using additional care or treatment and the indicated extraction can be performed. Contraindications are divided into two groups. Systemic contraindications. Local contraindications. Systemic contraindications. 1. Severe uncontrolled metabolic diseases, uncontrolled diabetes and end-stage renal disease. 2. Patients who have uncontrolled leukemia and lymphoma. 3. Patients with any of severe uncontrolled cardiac diseases, severe myocardial ischemia, such as unstable angina pectoris. Recent myocardial infarction, uncontrolled hypertension. 4. Patients who have severe bleeding disorders, hemophilia or severe platelet disorders, or patients taking anticoagulant therapy. 5. Patients who take certain drugs, corticosteroids, immunosuppressive, bisphosphonate and chemotherapeutic agents. 6. Pregnancy. Local contraindications. 1. A history of therapeutic radiation for cancer. 2. Teeth that are located within the area of malignant tumor. 3. Patients who have severe acute paracoronitis around an impacted mandibular third molar should not have the tooth extracted until the paracoronitis has been treated. 4. Central hemangioma. Clinical evaluation of teeth for removal. In the preoperative assessment period, the tooth to be extracted should be examined carefully to assess the difficulty of the extraction. 1. Access to the tooth. 2. Mobility of the tooth. A. Greater than normal mobility. B. Less than normal mobility. 3. Condition of the crown. Large caries. Endo. Calculus. Restoration. Radiographic examination of teeth for removal. The radiograph for exodontia must show the entire crown of the tooth, the adjacent tooth, mesial and distal, if appropriate, the entire root structure, relationship to adjacent vital structures. Radiographic examination of teeth for removal. Interpretation of the preoperative radiograph requires knowledge of normal radiographic anatomy, assessment of the condition of the surrounding bone, assessment of the adjacent vital structures, assessment of the condition of the adjacent teeth, assessment of the tooth in question. 1. Assessment of the condition of the surrounding bone. Alveolar bone loss. Bone density. Older age brittle denser bone difficult extraction and liable to fracture as not bending due to less cancellous bone. Abnormal hardening or thickening of bone leads to difficult extractions and also reduced resistance to infection and possibility for osteomyelitis. Associated apical pathology. 2. Assessment of the relationship to adjacent vital structures. Maxillary sinus. Nasal floor. Mandibular canal. Mental foramen. Potential risk for post-surgical oral antral communications for teeth in relation to maxillary sinus. High-risk sinus surrounds apices of teeth. Indentation of sinus floor. By roots of teeth. 1 or 2 isolated posterior teeth increase risk. Moderate risk sinus extends into furcation but roots are embedded in bone on either side. Low risk roots are below floor of sinus. 3. Assessment of the condition of the adjacent teeth. Caries. Restorations. Endodontics. Periodontal disease. Root proximity. No adjacent teeth. Relationship to unerupted teeth. 4. Assessment of the tooth in question. A. Extent of caries, extending to roots, fracture, or restorations. B. Root number. C. Root size. D. Combined root width. E. Individual root shape, root divergence and curvature. F. Individual root width and length. G. Root fracture or resorption. H. Endodontic treatment. Thanks for watching. Support us by likes and subscribe.